I had a few little things just jotted down here. Abby,
Okay.
sorry, just a second. I have a lady that is coming for treatment, and it's kind of mainly she's perimenopausal and a little bit of depression
Mm-hmm.
as well. And I was just wondering, do you know those lady care magnets that people get for symptoms of menopause or heavy periods? They're available here in our chemist.
Oh,
Um,
okay.
it's just called a lady care magnet.
Lady care magnets, and what you step on them? I mean, they're for the foot, or
No, that
where do you put them? Hmm?
you attach them to the it's just one magnet,
Oh,
and you attach it to the abdomen, kind of around rin 4
okay.
area, and it supposedly helps with menopausal symptoms or heavy periods or period pain, that type of thing. And I was just wondering, she's been wearing it when she comes for treatment. You just kind of attach it under your underwear, and it
Gotcha.
kind of fixes to the skin, kind of thing. But
Uh-huh.
I'm just wondering, do you think she should remove it during the treatment or not? I'm just wondering if it was affecting.
It possibly is. I mean, generally speaking, we tend to say that it's not good to mix magnets and needles. So when you do magnets, so I will do magnets at the end of the treatment. I'll put either magnets or press stacks, and I try not to do both. If there's a point that I specifically want a press stack on, so because that's a needle, I will tape a magnet on top of it. But these rules, I think the question is really, what is well, the question isn't really, one wonders, what is that magnet doing in general? Is it helping her? So the thing is to encourage her to, okay, don't wear the magnets, like for a day, say the day of treatment, and see what it does. But if someone's attached to having their damn magnet on, because how do you know what else they're wearing? Do you
Yeah.
know what I'm saying? It's like yeah, this one you happen to know, but they can have weird earrings or rings, or and there are things with rings sometimes, where I recommend to people, oh, this finger, has to do with digestion. You have digestion issues, and you're wearing a ring on your large intestine channel finger, and I can't tell, some people can tell, oh, silver is good for you for this particular thing, gold is good for you. That's kind of like the way it goes. There's one that's more tonifying, one that's more stating, and they can give you advice of, if you want a ring, have a gold one on this finger. I generally just tell them, you seem to have an issue with this here. Maybe you can get rid of this, this ring for a while. But I mean, if we start making it sound like what we do is so incredibly sensitive, in other words, if you can't counteract a magnet, can you actually counteract my depression? Sort of thing, so or my menopausal symptoms or whatever. So it's, yeah, I see your point. I'm wondering how much of it is is my need to control the situation versus, because I obviously do this also. I encounter this and going, oh, what the hell is going on here? I would let go, in fairness, because it's not worth the battle in case it becomes a battle.
Oh no, she wasn't. She had no problem removing it. I was just wondering myself, would it be better for her to kind of?
I honestly don't know. I mean, especially since if she has the magnets on Ren for the whole time, like she has it 7 days a week, 24 hours, then it's not like, if she put it's not like the treatment and the treatment is now interacting with the magnet as well as with her body. So no, if she was putting the magnet on 5 minutes before the treatment, I can say, okay, maybe something's different. But yeah, I mean, I honestly don't know. I don't have enough experience with and I've never, never had lady magnets. They don't sell them. Well, maybe they do sell them here, but I haven't seen them. So it's, but I've seen certainly people come with, the pericardium 6 magnets for nausea and stuff. And quite honestly, I'm yet to see one that really works. In other words, to see a patient, I mean, they're coming to see me and they're coming with a magnet. It means the magnet didn't do the job, right? So I think it's a great moneymaker out there. But I don't know that they're effective, but if it gives people a sense of comfort, then why not? But in terms of, does it interfere with the treatment? I don't really know. Sorry. Yeah. Anything else?
Gum disease.
Gum disease, okay.
Yeah. I know the large intestine is generally regarded as the tooth channel.
Yes.
I'm just wondering if there's anything else that you'd recommend treatment-wise?
Okay, so yeah, large intestine channel, possibly stomach also. So there is a gum point. So we call large intestine 6, but it's really not large intestine 6. So let's see if you can you see my hand?
Yeah.
So I have my index finger sort of where traditionally long 7 would be, and then my middle fingers goes above it, but it's not on large intestine channel. Well, maybe it is on large, and it's between those two. Find like a little nodule or a dent. So it's not exactly large intestine 6. We say that's the gum point. You can always try metal water of large intestine and or stomach. And for mouth in general, for example, because when we think of gums, we generally think of infection, right? So therefore metal water. And then sorry, I had one more that I was thinking about. Oh, but for example, you can have mouth sores that are in the gum. And mouth sores, we consider that a liver excess, as opposed to TCM that will be stomach excess. So I would try liver 3, spleen 3 combination also. So, they can like touch the gum, you can press liver 3, spleen 3, and see if it gets better. So, Camille, you had a comment?
I seem to have lost you there, Abby.
Oh, sorry. Okay. So the last thing was liver 3, spleen 3.
Yeah.
And can you hear me?
I can hear you now. Yeah, you just disappeared for a second.
I'm sorry. Okay. So liver 3, spleen 3, and they can touch the gum either through the skin or actually put their hand in. I wouldn't do it for them, but they can do it. Or with a tongue. And when you press spleen 3 and liver 3 together, and probably both sides anyway, they can say, oh, it's better or it's not. So those are the two, the 3 main things I would look at is this large intestine 6, which is officially a moxa point. Doesn't mean you can't needle it, but just so that officially it is moxa. Metal water of either large intestine and or stomach, and spleen 3, liver 3. Okay.
Yeah, thank you.
Anything else?
Camille, want to get in?
Sorry?
Macular degeneration.
Oh, boy.
And by the way, can I interject? Happy birthday, Avi.
Oh, thank you.
Very kind of you on your birthday.
It is my birthday, and I'm quite old by now. So.
Well,
so
may you live a long time.
Well, I don't know. Maybe not. But well, right now it's fine. Right now I'm happy to live. Maybe in 20 years or who knows when, maybe not so much. But well, macular degeneration. I don't have like a really good dogma for it. So, and it will depend to some extent because people can come with slightly different symptoms, you know, from dry eyes to different things with that. You know, well, actually dry eyes is not all that common. I'm just thinking of someone in particular that also had that. I would say eyes in general, okay, are liver 9. And possibly, you know, if you take liver 1 in the same way that you take pericardium 1, in other words, not as a jing well, but at the top, that's a possibility. The official reflex of eyes is supposed to be stomach 25. That, in my opinion, is not reliable. Okay. The claim is that it's supposed to be reliable if there's a rapid decline in the eyes. Now, the other thing about macular degeneration is that it has to do with the nerves, so therefore treat what you can with the nerves, which for me would suggest the parietal area. You know, so that's pretty much, and for eyes in general, always T5, T4, T5.
Oh.
I don't know if that's helpful enough. Now, you could, of course, also go and surround the eyes. In other words, you know, UB2, Yao, gallbladder 1, stomach, you know, stomach 1, etc. But I would really try and avoid that until I know the person better and I can't get results with anything else, etc. There is a treatment if you have toys. There is a treatment that I use where I put a chain in the ear, in each ear, and needle do 20. And I put the red and the green clips of the 3 bypass cord in each ear, on the chain of each ear. I tape the chain into the ear, and then I spark do 20. Okay, that's pretty. It's pretty powerful. They also feel it quite a bit. Not everybody likes that. So that's another option.
Thank you.
All right. And if I think of anything else, I'll also email you.
Thank you.
Yeah.
And then the other thing is,
Yeah.
you know, I had asked a couple of weeks ago about muscles, and another thought that I had for something I'd like to review sometime. It might not be today, but going through each level of the spine, and I'd love to hear an updated version of what your take on each level is, because it's probably been 20 years since I've heard you talk about that.
Okay. Yeah, I'm not sure it's changed a huge amount, but let me try. But okay, so actually with the muscles, let me see if I can do this weird sharing business. Hold on. Well, of course you can't see it, so it may not be.
Oh, I can see it. Yes.
Oh, you can. Oh, wait a second.
Oh,
it's weird. Oh, can you see?
Oh no, it's just giving a welcome screen.
Oh, well, yeah. I'm trying to get rid of that. I'm not sure how to do that. Damn it.
You're crossing it out with the cursor. I don't know if that's
I was trying to do something different and didn't do that. Undo this. No, it's not wanting to do that. Oh, damn.
Well, I don't want to throw anything at you. I mean, both of these are very big topics.
No. I actually had this. I had the muscles like in a little chart and stuff, so I was gonna like be fancy and share and, you know, and do it visually, but it didn't seem to work. So, so here I have a little piece of paper that has them. So for muscles, I mean, I'm going back to muscles, and then we'll do the spine. How's that?
Yes, lovely.
So this is what I came up with muscles. So I use kidney 7. Oh, it's some of these things are kind of on the weird side. That's why they stood out for me. I use kidney 7 for gallbladder channel below the knee, peroneal muscle, as well as if they have an ankle sprain on gallbladder 40, that's kidney 7 indication for me. Gallbladder above the knee, on the other hand, is spleen 9. Okay. And also spleen 9 I use for hips. For the tibialis anterior, I use Ren 12. Okay. And on the other hand, stomach 41, which is kind of part of, and stomach G, which is part of the tibialis anterior, I use for the quads. Okay. For the
Sorry.
hamstring,
I'm sorry. What point did you say for the quads?
stomach 41 or stomach chi.
Okay. Thank you.
And the hamstrings are UB20. Possibly,
Oh.
possibly also T11, T12, Hua Tuo.
Sorry, Abby, what did you say? The hamstring was a bit of a...
Hamstring is UB20 and possibly T11, T12. Okay.
That's very interesting.
Yeah, well, okay, so this comes from the idea is that the hamstring and the quads, by the way, also, they're the biggest muscles, they're the biggest consumer of energy, therefore, okay? They're not the strongest muscle. The strongest muscle is supposed to be the masseter, but the biggest muscle in terms of capacity, you know, space, therefore is going to consume a lot of energy, is the hamstring, and therefore connects to sugar metabolism. Okay.
And that goes in line with what Kiko says about people with hamstring issues probably consumed a lot of sugar.
Possibly. I don't recall that personally, but that makes sense.
Yeah.
I mean, people with muscle issues in general. So people come with either very tight muscles or atrophied muscles. You know, the kind that, you know, there's just where, how come your muscles are not contracting, are often sugar types. You know, not just the hamstring, but it makes sense that the hamstring would be the, you know, because it is the biggest example of it, let's say, the hamstring and the quads both. And then you have liver 4 for the psoas.
Yeah.
For the deltoid, I usually use UB42 or 43 towards the scapula. Okay. For the quadratus lumborum, it's kidney 7 and lung 10. And for the SCM, of course, is Sanjiao 8. Possibly Sanjiao.
I'm sorry, I need you to go more slowly, Avi.
Sure. Okay.
Can you go?
Where were we?
Oh, and you also cut out. So I lost you at the QL, the quadratus lumborum.
The QL is kidney 7 and lung 10.
Ah. Oh, right. Lung 10. Yes.
Which is supposed to be with Moxa.
I remember that. Yeah.
Yeah. And the SCM is, of course, Sanjiao 8, possibly Sanjiao 5. Sometimes immune will do a good job for the SCM also.
Yes, it does.
Yeah. And then the other point and by the way, the official dogma for the SCM is opposite side Sanjiao. That's the official dogma. I can tell you that same side works. Also.
You've frozen.
Oh, it might be my internet connection.
Avi, you've frozen.
Yeah, hold on.
Okay, you froze for a good minute.
Okay. Yeah, it looks like my internet connection is a little bit weird.
Okay.
So let's go
so
back.
I left you off at immune for the SCM, and that's where you froze.
Right. So the Sanjiao points are supposed to be opposite side of the SCM, but they can also be same side will work also. So I would consider same side as well for the SCM. And stomach 41 is a good point to release the SCM, as well as kidney 7 or kidney 9. Trying to play and see if I can make sure it doesn't happen again. The scalenes, which are important because they control a lot of the shoulders, the neck, etc. The scalenes are released officially by spleen 3, but I would also give heart 3, inner yin, and lung 8 a try. So you may actually end up doing 4 points to release the scalenes. Then muscles in general is supposed to be in the spleen 3 category, but sometimes spleen 9 does a better job than spleen 3. Okay. And anything that has to do with tendons or ligaments is a liver 8 or liver 4 category. So interestingly enough, gallbladder 34 is what I call torque, meaning small twists in the tendon or ligament, for example, sacroiliac ligaments, as opposed to a tendon like, you have tendons in the shoulder, and gallbladder 34 is not as likely to do a good job, for say a torn or a strained ligament, as much as something that's torqued. Okay. And the last one, the last things I said that I wrote down is that in any muscular things, always consider sacroiliac ligaments. I believe Nagano called the sacroiliac ligaments bending stretching. Because obviously when you bend and stretch the torso, the sacroiliac ligaments stretch and contract. But they also affect other bending and stretching, specifically of the knee and the thigh. And then inner yin is very important for muscular stuff because it gives you a sense of core, it gives you a sense of centeredness. So often many muscle issues happen because if the person doesn't have a sense of safety, not safety emotionally, but, if the core isn't held, then the extremities are, get overpulled. So if they can bring that tension back to the core, to the perineal floor, which you're trying to do with inner yin, then the muscles get a chance to relax. Okay. And the other one is UB36, which Cheng Fu it means to support the support. So obviously it's a location thing because it's on the ischial, the attachment of the hamstring to the ischial, which means it controls the biggest axis in the body, the biggest hinge in the body. But it affects the whole posture. It affects the whole spine and the whole back. So UB36 is a really useful point in general. Kawai used a point that's about 2 fingers below UB36 for back pain in general. But I'm not so shy. I'm very happy to go straight into that ischial tuberosity. And then I'll go more medial, more lateral, whatever is needed. So that's in terms of what I was conjuring up for muscles when you asked 2 weeks ago. In terms of the spine, okay, let's see. Let's start.
Can I ask one more muscle question? Do you have anything for the teres minor, which seems to also involve the great low of the spleen, which is not really something that I hear Kiko talk about, but
okay.
But sort of those outer edges of the scapula, I've never really found a correlation there.
Yes. So it depends on what you have there. I mean, so I have to admit that teres minor does not ring the biggest bell for me. Like I could not recite you where I know it has to do something with the scapula, and the rest I wouldn't know the attachment. But that's a muscle that's also over the intercostals. So what I would try for that, okay, a few things. This is not a dogma. This is like me kind of thinking, okay, if I have a paper that shows this, these are the things that I would try. And I would associate more, I guess I would associate more with gallbladder 22, personally, rather than 21, but they're kind of the same. So it's just a matter of my mentality says, gallbladder 22. So the few things that I would try lung 4, with a possibility of liver 4 also. Why? Because these are the points that are good for intercostals. Okay, lung 4 increases the capacity of the breathing capacity of the ribs, the expansion of the ribs, so it relaxes. It relaxes the intercostals, so it may just get the teres also. Heart 3 would be another option. I would, Sanjar 22 area could do a good job for this also, or right above the apex of the ear. And I would definitely go for T5 And either probably T11, T12 rather than, I know it's not attaching there, but it has to do with the lats also. Okay, because if your teres is out, it means that your latissimus dorsi is also going to pull out. Does that make sense?
Yes.
Because you can't get this, if I'm imagining the teres minor correctly, it controls how the scapula is drawn into the back, is pulled into the back. So if it's painful or strained or whatever, it means the scapula is not going to be stabilized well. Okay, so number one, the inner border of the scapula, needle towards the scapula would be one thing, and anything that gets the lats and the attachment of the lat is T11, T12, L1 possibly. So those are the things that come to mind that are that sound to me like they're worth trying.
Thank you so much. Yeah, it really gets strained when people round their shoulders forward, because then it has to really stretch more than it's intended.
Okay, so meaning they're curled in.
Yeah, when they curl their shoulder, like when they're sitting at the computer all day,
okay.
And they're curled forward, and their chest is really compressed. The teres minor is on the side of the outer edge, and it has to stretch way further than it was intended, and so it goes into spasms that are stubborn.
Okay, so now that I have that information, I would suggest to you, okay, so the people who do this posture of curling forward, it's partially, again, that they don't have a good sense of the perineal floor. They're not pressing down in their legs. I mean, they're not curling over just because they're looking at a screen. They're curling over because as they're looking at the screen, they're not using their legs. Chances are their feet are off the floor. Okay. Maybe the toes are on the floor, but their heels are not. So what you want to do is activate the inner thigh, give them a sense of their legs. It's really amazing how little we use the legs. Okay, especially if we're sitting. Okay, so the moment we're getting into mental capacity, we're not using the legs. So now you have your inner yin and your UB36. Get them a sense of the legs and possibly Mushu also. Now, to actually open lung 1, lung 2, that's a kidney 7, gallbladder 26 function. Kidney 7 and gallbladder 26 will open up or allow for the opening up of lung 1, lung 2. And, but yeah, you kind of want to really look at what's happening, let's say, in the rhomboids between the scapula and the spine also, and see if you can affect the teres from there. What, in my opinion, does not work for these people or works very temporarily is when people show them how to retract the scapula together and compress the spine in the back. And yes, they opened up the chest, they feel great for a second, but they opened up the chest in the front, but they closed it in the back. So I understand that it's a countermeasure to what they were doing. So the trick is, how can you get them to open up both the front and the back at the same time? And the fact is that their whole, what is this called, the glenoid, the whole shoulder is going to be out of place. That the way the arm is fitted in into the body is going to be somewhat in the wrong way because of this habit. So this is where either lung 5 and or heart 3 may help you. But essentially, you kind of have to put their hand on their scapula as they're facing up, push it up towards their chest and down into the back. So you're pressing it into the back, but then down towards L2, let's say. Okay, and then the other hand can open up the, externally rotate the arm. Does that make sense?
Oh, yes.
Okay, I think that's just to give them a sense of something else is possible. Because some of these muscles, basically, they need to get, like, even if you give it to them for 5 seconds, just give them the option. You know, give them muscle the knowledge, oh wow, there is a possibility. So just when you give them an option of, look, if you use your leg, this muscle doesn't have to do this. Okay, the upper body doesn't have to strain when your inner legs and your abdomen are ever so slightly engaged. You know, you don't want to make them feel like, oh, I have to be Schwarzenegger now, because then they'll never do it, and it is too much. But just ever so slightly engaged. Just press your heels down into the floor and press your thighs into the chair and see what happens to your posture. Your waist lengthens a little bit, and your shoulders open, and in the correct way, as opposed to open by squeezing.
Okay. And for the rhomboids, you had taught liver 4. Is there anything else that you would?
Rhomboids? No. Rhomboids is not liver 4. I'm not sure where. I'll have to try that. I'm not aware of that. Is that something that works?
I think it can work. Yes, it's not consistent, but that's what I have in my notes from you.
Oh, okay. Okay,
But again, this is all very old stuff.
Yeah, I have no idea. The rhomboids are basically, okay, you have a number of things for rhomboids. So you have your 4 corners. Okay, the small intestine 910. You have the Yao Yan Shu. You know, the extra point that's level with the small, at the dimple of the iliac crest, needled down and out, and the small intestine 910 needled up and out. You have your trochanter point, gallbladder 29 in front of the trochanter is very good for rhomboids, and I think we talked about that. You asked about that a few weeks ago. Those are good. The reason I'm thinking liver 4 works better for, you know, because I said, oh, it's good for the tear. It could conceivably be good for the teres, for expansion of the ribs, and the rhomboids are involved. It's just that the rhomboids are a much thicker muscle, and I don't know if that's it's a much stronger overlay as opposed to the teres, which, in my sense, and maybe I'm totally wrong, is somewhat, it's a thinner. It's not quite as strong as the rhomboids are, but I could be wrong. So
no, that would be true. That would be true.
Yeah, so that's why I can see liver 4 in my imagination. Liver 4 and teres resonates a lot stronger than liver 4 and the rhomboids. But you know, you never know. And then in the rhomboids again, because you can if the problem is in a actual muscle, you can needle the Hua Tuos and hope that it releases.
Yes.
So.
Super. Thank you so much.
You're welcome. So the levels of the spine. Okay, let's do it from the bottom.
Sorry, Edwy, just before you go on, maybe, what about the paraspinals?
Paraspinals, they can be quite tricky. Okay, so they could be a liver 8 indication, especially if the person's jumping. They could be sacroiliac. The sacroiliac ligaments, if you needle those, the rest of the paraspinals tend to relax. Okay, as well as UB36 is another option. Okay. And one more option is DO 2 with DO 15.
Okay, thank you.
You're welcome. So, all right, so let's start. The sacrum basically has, let's see if I can get this 100% right. So UB32 has a few effects besides being hormonal. So first of all, the sacral foramens have to do with the parasympathetic nerve, you know, because there's a parasympathetic ganglia there, you know, right in front of the sacrum. So that's a really important area to release in general. Then, you know, I usually do that more through the sacroiliac ligaments than the actual UB31, 32, 33, 34. So UB34, I believe, is testosterone. UB32 is a women's point, and UB31 is the men's point. Now, obviously, UB32 is, well, not just obviously, but, you know, really in my experience, the level of UB32, including the sacroiliac ligaments, is the most powerful in general, tends to be. So UB32 is also good for eyes, or can be good for eyes. I'm not sure about macular degeneration, but you know, it is a point that I kind of add while I'm at it. It's good for the esophagus as well. So these are two kind of unusual uses of UB32. Okay. Obviously, neither one of them you can test very easily. Sometimes people with the esophagus may show something around between T5 and T3, but they might not. So it's not so easy to test. Oh, I'm pressing on UB32 and look, the esophagus gets better because you can't press on the front. So that's the sacrum. L5 relates to a few things. Obviously the legs, you know, sciatica, etc., etc. It relates to the bladder and hemorrhoids. So it's definitely a point that's you know, and some people with hemorrhoids will actually have varicose veins around L5, in which case if you want to bleed them, be my guest. It does help. But even if you just needle, it's useful. Okay, so that's L5. Then don't have, well, and obviously well, the thing about needling L5 is it's not that common that, well, since so many people come for L5 problems, it's often a point that I won't necessarily needle. And what I'll do is I'll put a diode ring and aluminum foil on it as a way of treating it, because I don't like needling into a problem, because so many people have disc problems around L5, creating other problems. But it is important, so if, you know, it's an important point for things like neuropathy, things of that nature, and any lower limb kind of problem. L3 relates to the hip. I don't have a dogma for L4. Sorry, I skipped that one. L2 relates to the brain, possibly relates to the ears. Can't fully guarantee that that's the case. Occasionally it works, and quite often it doesn't for ears. You know, I think it's a very cute dogma from the TCM idea of kidneys and ears, but not necessarily. But it is related to the brain, because the dura mater basically comes down to around L2. So there's a kind of a direct connection from L2 to the brain. L1, L1 is related to the inguinal. If people have inguinal pain, that could be related to L1. Personal experience, not all inguinal pain or inner thigh pain is necessarily L1. Notice that there are other things that will reflect onto the inguinal and the top inner thigh. A lot of hip problems reflect into that area also. Okay, so just to have some awareness of that. T11 and T12 are related to two big things. One is sugar consumption. Okay, and many people will have puffiness around there. And two, it's going to relate to the whole way the spine moves, because it's a shifting. It does, not only does it shift from lumbar to thoracic, it also, this is where the kyphotic curve, the lumbar curve changes into a kyphotic curve. So many people will have a huge sinking down into T11, 12. It's all sinking, and because, you know, really what happens is between the ribs and the hips, there are no bones. So there's nothing that's going to lift it. You know, like everything else, if you sink in your thigh, well, there's bones that catch each other. You may be compressing your knee more than you want to and eventually get knee pain, but the bones of the leg are going to catch it. In the torso, there's no such thing. Okay, so in the waist, there's no bone to catch the ribs as it's falling into the iliac crest, into the hips. So what happens is many people, because they're not lifting up, because that's not something we just don't do that. We just walk around like schleps, and we sit around like schleps. No, I mean, you know, that's just, yeah. It requires a little bit of consciousness to like sit and actually use your legs. What we want to do is we want to go and sit back, you know, and lean on the chair or lean on the sofa and do nothing. And it's just ever so slight amount of using the leg that prevents a lot of this, that counters gravity. And that's going to show often on T11, T12. So T11, T12 is super important for any sort of musculoskeletal issues. You know, not just, and it's important to activate the spine. Therefore, it's part of the thyroid protocol, hypothyroid, which is due to T11, T12, T7, and T5. So notice what it's doing is it's picking up all the the shifting curves of the spine in order to activate the spine, because hypothyroid is, we can call it lack of yang. So you're activating the yang channel, so to speak.
Can you say the list, the full list for hypothyroid again?
Due to upwards, T11, T12, T7, and T5. Now, be very liberal in your definition of T7 and T5. You know, one vertebrae up, one vertebrae up or down, or even two, no big deal. Both on T7 and T5. T11, T12 is, you know, you already have two, so it's going to be fairly exact, or it's going to fall within what you'd call T11, T12. But the T5 and the T7, I mean, don't just go edge of scapula inward. Oh, that's my T. You know, look for the weird. You know, that's something that's going to help lift it up, push it up, as opposed to, so if it happens to be T9, that's totally fine. No big deal.
Okay. And would you adjust that list at all if it's Hashi's to include immune?
Yes.
I mean, above and beyond the standard immune or the standard thyroid stuff.
Yeah. Well, the problem with Hashimoto's is this. I think my personal, and we're on different coasts. So, and Mary-Jo, you're in England. I don't know what they do in England, but what I'm noticing on this side is people are being diagnosed with Hashimoto's, and it's like totally, I don't know. That's not the traditional way Hashimoto's would have been considered. But lots of people seem to get that, and they do have blood tests that show it. They're hypothyroid, and they're immediately diagnosed with Hashimoto's because they have some sort of antibody in blood tests. But they never went through a hyper. In other words, the inflammation never showed. But if it is officially Hashimoto's, I will add, why not, the autoimmune protocol, which on the front, so let's go back. So autoimmune on the front is REN4 if the pulse is not rapid, if the pulse is not slow, sorry. If the pulse is not slow, you can do REN4 plus kidney points plus lung points. Now notice that kidney points is what you treat thyroid with anyway. The thyroid for me belongs in the kidney category. Okay, it's a metabolic gland, and the throat, the kidney channel circles the throat. So it makes sense. Yes, you can add stomach G for thyroid also. It's not like it can't, that's totally, you know, that the idea in TCM that the thyroid is stomach fire or spleen G deficiency, it's not like it's totally wrong, but therapeutically in terms of acupuncture, the kidney channel tends to do a better job for it. Okay. And so you have your REN4, kidney points, and lung points. And if you can't do REN4, what you do is you do REN4 go all the way to the side, meaning Mushu, gallbladder 27, side gallbladder 27, and do that instead. On the back, your points are going to be translated exactly, you know, opposite is either UB26 or UB27. Basically, you're talking about the sacroiliac ligaments. Okay, the top of the sacrum, the top corners of the sacrum, you may have like little ping pong balls there. UB52, needle towards the spine. That's your equivalent of a kidney point, you know, in the front. And UB42, or possibly 43, needled outwards towards the scapula, and that's your equivalent of a lung point. So basically translating, this treatment is considered metal water, systemic metal water. Your water is the kidney, the metal is the lung, and you're using the small intestine, mu or shu, as, you know, for fire. Okay, yang of fire, because the idea being that autoimmune disorders are basically systemic inflammation. Okay. So yes, I would, for Hashimoto's, I would add autoimmune treatment, because hey, why not? And then of course everything is subject to, you know, does it actually prove itself? You know, it's like I try as much as possible to avoid just needling a point because theoretically it's supposed to be good for you, you know, or good for the patient, not good for me necessarily. No, I mean, that's the problem. It's good for me. It's good for my brain because, oh, I read yesterday, this point is really good for this. So I'll just needle it. Well, yeah, it's going to take me 10 years before I figure out if that point really does what it does if I don't test it on a regular basis. You know, if I just needle it because the person has the label. But at the same time, you know, if the person comes with a label and I have a protocol for the label, I would rather find out what are the best points, and then even if the protocol for the label didn't work 100%, I might also throw it in. I take insurance. You know, no, you know, it's like, you know, it's like just in case, just throw it in. It could prove to be useful, but I'd rather test it and go, oh wow, it really fixes, you know, your gums, or it fixes your eye, or it fixes your ear, even though it wasn't supposed to. Then I know, oh wow, it really does work. You know, what else? Oh, so are we back to the spine?
Yes, and you were still in T11, T12, and I don't want to divert too far from that. Yes,
okay.
But thank you.
T11, T12 is really super important. Now, on the left side of T11, T12, not quite on the spine, a little further out, and possibly further down also, are as a point for food allergies. Okay, what happens? This is where fats from the small intestine get stored in the cisterna chyli before it goes to the liver. So often that's where you can affect food allergies from this area. Some people literally have a little nodule, you know, just outside the spine, just outside the Hua Tuo, somewhere, you know, T11, T12, L1, you know. So that's possibly a good point.
Wow.
For food allergies. Not the only point by any stretch of the imagination. It's one more thing to do. I mean, consider everything else that's going on. You know, this is not like the magic, you know, it reminds me of like there used to be the magic thyroid point and everybody wanted to use the magic thyroid point, and it's not like big deal, you know. It's called magic, but you know, but it's not so powerful. This is not the magic food allergy point. It's one point that can be looked at. T10 on the right side belongs to the gallbladder. And I will needle it for gallbladder, as well as T2 belongs to gallbladder, as well as right small intestine 11. T9, that was T10. T9 is obviously liver on the right side. And, you know, and I would release it first with left UB35. Some people will only show liver on the right side on the back and will not show it on the front. It can happen. Okay, so it's, you know, sometimes you're convinced you've got to be, why the hell is your liver not showing? Why isn't it showing? And then you turn them over and they go, oh yeah, now it's showing, thank you. T8 supposedly relates to the pancreas. I can't say I have like the clearest picture of that or the greatest success with that. But it's something to consider. The problem here is that T6, T7, T8 all kind of like intermix a little bit, and they belong to the autonomic nervous system. And here we're talking about the UB line as well as the Hua Tuos. And now I do tend to needle Hua Tuos much more than I needle the Do. It's pretty rare for me to needle the Do. I like the Hua Tuos better. Now I used to needle Hua Tuos 45 degrees into the spine. I now needle them either totally upwards or 45 degrees in and 45 degrees up, because I'm interested in being able to lengthen the spine out because there's so much compression in people's spines downwards. And if you just needle 45 degrees in, yes, you create a little bit of a quote-unquote barrier from the falling down of the spine. But if you're needling upwards, you're also jolting them up a little bit. So my preference is to give it a certain amount of upness. So T7, T6, T7, T8 all relate to the autonomic nervous system, the diaphragm, insomnia, asthma, things of that nature, because asthma is a spasm. And by the way, T9 is T9 or T8, sorry, T8 is supposed to be related to children, bedwetting in children. I can say that I have one patient who had bladder problems, male patient who had bladder problems and was bedwetting until a late age, and he does have something odd in T8. But I've not been able to help to fix the problem by needling T8 necessarily. So I fix the problem because urogenital issues with males is highly related to their SCM. It's highly related to the nervous system. So releasing the SCM and then needling stomach 9 is much better for urogenital issues for males than certainly than this particular person in T8. But that's one person that I did find it, so I can say that I can see where it's coming from, but I don't know that it's. But I haven't had much effect with it. T5 relates to obviously the Shen. It's level with the heart tube, but it also relates to the stomach, as well as T4, by the way, would relate to the stomach. By the way, T6 also is supposed to be related to the pancreas. And again, just like with T8, I can't guarantee that that's 100%. You know, I don't have like 100% clarity on that. Like I can say, oh yeah, do this and it will get better. T4 relates to eyes. Now T4 and T5 relate to the neck. T3, I don't have anything in particular for. It's all, you know, the problem is it all gets merged with, you know, the people who have these upper thoracic are going to be all mixed in with psychosomatic issues, as well as for women, breast issues. If you have very tight spine, upper thoracic spine, it can affect the breast, the circulation into the breast, or maybe it's through the nerves. T2 specifically relates to thymus, as well as on the right side to the gallbladder. T1 relates to circulation. The name of Hua Tuo of UB11, no, not UB11, the dew point, dew 13, below dew 14, which is a T1, is called Hua Tuo, which means the path, kind of a happy path. Ellis translates it's something to do with pottery, and it actually isn't. So it allows microcirculation to open, it seems to me, T1. Okay, most people tend to think that dew 14 does a better job on that. I actually think it does a good job for that. And then dew 14 itself, the level of C7T1 is good for tailbone injury, as well as circulation, and of course coughing, just like with not sneezing, coughing. You know, it's Ding Chuan level. Then in the neck, what you have is C3, C4 is related to the phrenic nerve. And so on the right side, we say it's related to the liver presentations will show on C3, C4. On the left side, we say it's possibly cardiac presentation, but it can just be a stuck diaphragm, so it can show on both sides. Then that's pretty much what I have in the neck. I don't have like clarity about, you know, I mean, I know that you have C6, you know, C5, C6 will start affecting the arms and stuff like that, whereas above it doesn't, etc., etc. But it's mostly I'm releasing without having any reflex. I'm releasing it, you know, primarily to release blood flow into the brain. I'm always releasing the cervicals regardless. I'm very interested in releasing the cervicals.
Wow, fabulous. Thank you, Avi.
You're most welcome. Anything else?
Just quickly, Avi, when you say T11, T12, Between those vertebrae, are you taking 2 points, T11 and T12?
Okay, T11, T12 means that whole area. So you have about possibly 1.5 inches or 2 worth from the bottom of T12 to just above T11. Usually it's above T11 is not very likely, but it can be level of T11, can be below T11, between T11, T12, can be level of T12, can be below T12. So it's an area. So I'm not really, when I'm looking for a Hua Tuo point, I'm not looking for it to be between the 2 vertebrae. Okay, I'm looking for something that usually feels gummy, like there's extra tissue there, like an overstretched balloon or a little ping pong ball or something hard. I'm looking for tissue that doesn't feel right. Okay, so if it happens to be between the vertebrae, fine. If it happens to be level with the vertebrae, that's fine. I'm not that concerned.
You needle into the
abnormal tissue. Yeah, I'm trying to break down that abnormal tissue. Yes.
Okay. Thank you.
Anything else?
Not here. Thank you. That was really super.
Good.
I really appreciate it.
No problem. I'm glad. And if I can think of anything else as I go along in the day, I'll write it down and bring it up. No, you never know what you come up with. And, this is what comes up to me spontaneously when you ask. But then I'm going, oh, wait a second. But what about blah, 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 and blah, 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 and blah, blah, blah. So there's always more options. There's also more options on the back, and I'll make a list of that, because we talked about the spine, but I don't do a lot of things outside the Hua Tuos, but there are a few things that I do.
Okay.
Like UB43, I'm very interested in, because it has to do with circulation. It sits behind the lungs and the heart, things of that nature. Smite destiny 11 can be useful. The arm, there's more to, the back is bigger than just the spine. But I do tend to work the spine primarily, with the exception of UB52 and UB42, Smite destiny 11 as well. So, all right. Well, happy Peace Day, and veterans like me who are getting older. So,
I didn't know you were a veteran, Avi.
I'm a veteran of life.
Yes.
Yes. Somebody wrote on Facebook. They say, they wrote Sensei Avi. I'm like, I'm not Sensei. Sensei means xiangshen, means lived before. I'm still alive. I haven't lived before, but I'm a veteran. But I do have some experience in this life that I can share. So that's what I do. But so yeah, I'm a veteran of life, not of the army.
Well, thank you for your generosity and both your time and your knowledge. Very appreciate today. Thank you.
Thank you, and we'll talk soon.
Okay. Bye-bye.
Bye. Bye, Mary Jo.
Thank you, Abby. Have a good birthday.
Thank you. Bye.
Yes. Bye.
Celebrate.